Hello, Assalamualaikum. My name is Aimi and I'm 19 years old and this is my cancer story. I'm sorry if I hesitate to talk because generally I am from Malaysia. So basically my mother tongue is Malay. So my English isn't gonna be that good, but I think it's understandable. I don't know. So anyways, I just want to make this general so that everybody can understand. So that's why I speak in English. So for all of you Malaysians who thinks that I am faking accent and I'm trying to be a Mat Saleh, no, I am not trying to be a Mat Saleh, and this is English. We use English too. It's our second language, so you should know. So anyways, whoever do not understand English, you can ask me in, well, I only speak Bahasa and English, so if you want to ask me in Bahasa, you can comment below. So other than that, I'm so sorry, I really don't speak other languages, sorry. Okay, I know most of you do not know why I have been in the hospital for like quite some times. Well, it's because I have been diagnosed with Hodgkin's lymphoma. Hodgkin's lymphoma is a type of blood cancer which occurs in the lymph node. These are the several symptoms which I experienced before I know I have Hodgkin's lymphoma. So the first very obvious symptom is that I am easily tired. Well, at first I thought it's because the distance I traveled every day from my home to my school, but and due to tons of homework in Form 6, I'm doing Form 6 in SMK Convent Bukit Nanas, Kuala Lumpur, and I thought it's because of that, being stressed and stuff, and I thought being fatigued in Form 6 is like very common. But my teacher told me that I have been turning out to be very weak and I sleep a lot in class. And also, I thought that was common because I have been sleeping in class since freshman year. So, I don't know, people around you usually notice a difference in you and you don't. Also, my parents saw my fatigueness as well. So, I guess I am very tired. So the next thing I notice is that I have a lump here. It's called the supraclavicular lymph node, which is just on top of your collarbones. Well, I am very cautious of my own health, so I googled it. I googled on what if I have a swollen lymph node or swollen lymph node on top of your collarbone, because I didn't know what supraclavicular node was before, so now I know, I can say it anyway without reading it anyway. So, and then it says that common causes of that is cancer, obviously, and I was scared because I am so cautious of myself, so I kept on thinking that I was cancer. So I told my mom about the lump, and my mom was like, stop being so cautious, you're just inviting the cancer to develop, I don't know. And then I'm like, but I'm scared, and then she told me to go to the clinic. So I did. I went to the clinic and the doctor was giving me a serious face, and then I was like, it's not cancer. And then she's like, no, I didn't say it to her face, it's just my expression. She told me, okay, she gave me antibiotic for about a week because she said it might be due to an infection somewhere, although I have not experienced any fever or coughing or whatever common symptoms usually lymphoma people get. But she gave me the antibiotic anyways, and then she told me to finish it in about a week, and then she told me if it doesn't shrink then I had to go to the clinic, and she referred me to Kajang Specialist Hospital. So And then, as you can tell, it doesn't shrink. So she actually gave me a reference letter to go to KPG. I mean, to the Kajang Specialist Hospital, and I did go there. And then they did CT scan, X-ray, and also ultrasound. What they found out is that I have a lump on my chest because well, the doctor told me that usually if you have a swollen lymph node here, it's probably due to having a tumor around your, I mean, at your abdominal area. Sorry lah. Yeah, and then they found out that I had the lump. It's like that big here, and I instantly thought that I have to undergo a surgery because I don't know, because I thought it was a tumor, and then the doctor said they have to find out what that is. So they have to and I have to undergo biopsy just to know what that is, whether it should be removed or it should not. So I did do the biopsy. And it hurts. Biopsy hurts even though I'm under local anesthetic. I can still feel it. So they did it. And they told me to come back after 2 days to see the results. Also, they took my blood sample. Maybe it's, I don't know, it's, they need it. So I came back after 2 days. Like, I have been getting like positive views from people, and they say that it's gonna be nothing, don't worry so much. And I wasn't worried. I was like, I'm pretty sure it wasn't anything like this, because I don't know, I think because of the positive feedbacks, I don't know. And then I went to the hospital after 2 days, and they told me I had Hodgkin's lymphoma, and I was like, okay. And the doctor said, oh, you're very calm, I guess you're very ready to hear. And I'm like, nah, I didn't know what lymphoma is. And then he's like, oh, you can Google it, and then you can see whatever that is. And I'm like, okay, what is it anyway? And then she told me that it's some kind of a cancer. I mean, and I'm like, okay. So I have to undergo chemotherapy, he told me. But I cannot stay in Kajang Specialist Hospital. He had to transfer me in Ampang Putri, Kuala Lumpur Specialist Hospital. So I had to go there, and I did. And he told me, the doctor in Kajang Specialist Hospital told me that the hemologist in Ampang Putri will explain to me further info about what I'm facing. So I did. I went to Ampang Putri, and then the doctor there, Dr. Go, she's the only hemologist there, told me that I have to undergo 4 cycles of chemotherapy, which is the least chemo cycle a cancer patient can get. And I'm very happy. I don't know. She said that lymphoma is the easiest cancer to treat, and I'm like, alhamdulillah, okay. And then she told me about inserting some type of a pot. It's called a chemo pot. It's here. It's like this plastic rubber like pot, round thing. They insert it under my skin, and it's like connected to a wire straight to my vein. I mean my main vein. So I won't feel pain during the chemo. So they're just gonna insert the chemo through my pot. So they did that. I undergo a surgery just to insert the chemo pot, and it doesn't hurt. After a few days, it's okay. It does at first, but then I get used to it, and it's okay now. And then when they did my chemo, I didn't feel any pain, which is good, alhamdulillah. So let me tell you something about chemo. Well, chemo, it doesn't hurt. It's just like a drip of drugs. It's like a drip, you know. It's from a bag, They just inserted it here, and I wasn't feeling, I don't feel anything. But then the effects of the chemo, yeah, that's bad. The effect is really bad. I faced chest pains, pains everywhere, sharp knife-like pains, and nausea, and I puke a lot. My hair, they are all abandoned, and I'm bald. But alhamdulillah, in Islam you have to wear hijab, so that's the positive side of it, alhamdulillah. And then after 6 days of chemo, after the bad side effects, 6 days of bad side effects, I get better. And this is me, all better, but I have to undergo chemo again every 2 weeks. I get better, go chemo. I get better and go chemo. So that's basically my story, and I have only completed 1 cycle, so I have 3 to go. Pray for me, and thank you for listening to my rants, and I hope to annoy you guys again soon. So, you know, on my chemo, my cancer update. So thank you for listening. Alhamdulillah, I have done my first video. Bye. Assalamualaikum.